Good day friends, I am Dr. A.S.K. Gupta and I am going to talk to you about the congenital diaphragmatic hernia in a patient who has come to us for the ultrasound examination at 37 weeks of gestation. When we see this scan, we find that this is the kidney of the fetus, and when we go into the abdomen, we find there is a cystic mass over here. What is the cystic mass? Let us try to find out. Whenever we find a cyst, we should always look for the kidneys. And we find that the kidneys are very well seen. This is the stomach on the left hand side because the patient is having a cephalic position, and the cephalic position means this side has to be left side of the fetus and this has to be right side of the fetus. You can see that the heart has been pushed onto one side. Usually this is not the position of the heart. And when I saw the heart in this position, I found that the heart has been shifted to one direction, and this is the normal anatomy which is not there, and it should prompt one to look for some anomaly somewhere. And if we go this way, we will not be able to miss anything. And we are trying to do a transthoracic scan, a longitudinal scan at the level of thorax, and we see that the heart has been shifted on the right hand side, and there is some viscous organ over here inside the thorax. And what is this likely to be? Whenever some viscous organs they herniate from the abdomen into the thoracic cavity, on the left hand side they are either the colon or the stomach. This is a longitudinal structure and it appears like a colon. So we are probably dealing with a case of colonic herniation from the abdomen into the thorax of the baby, which is pushing the heart on the right hand side. And such babies are likely to have very poor prognosis. These hernias are generally posterior in nature and they are laterally placed. And here we can see that there is something herniating. This is the thorax because you can see the ribs, and the heart is also seen. Somewhere here is the abdomen, and there is some viscous organ over here, which is most probably the colon. This is the transverse section of the abdomen at the level of herniation, and you can see this is the colon most probably, and this is the left side of the baby, and this is the small bubble which is the stomach. The stomach must have been pulled up and the anatomy has been disturbed. Let us try to see further. This is the longitudinal scan that I am trying to do, and I am going to take you slowly, and you can see that the heart is there on the right hand side. This is the left hand side of the fetus, and you can see that there is some structure on the left hand side. I'm going to show you this clip again so that you can see the herniation, and probably we are dealing with the hernia of the colon into the thoracic cavity. If the hernia is there on the left hand side, it is the colon, and if it is on the right hand side, it is the liver, which generally herniates. You can see again, this is the colon. You can see clearly this is the colon, and this is the lung tissue, and this is the heart. And this is the level of herniation because this is likely to be the diaphragm. Most of the hernias are generally lateral and posterior. Sometimes the hernias can be anterior. Also, 85% of the patients, the hernias are on the left hand side, and 15% of the patients, rather 13% of the patients, the hernia is on the right hand side involving the liver, and 2% of the patients, the hernia can be bilateral and it carries a poor prognosis. This is the heart on the right hand side, this is the colon on the left hand side, this is a transthoracic longitudinal sagittal scan, and you can see this can be even stomach. We do not know because the anatomy is disturbed, so we cannot find out things very clearly. This is the urinary bladder of the fetus, and you can see both the umbilical arteries on side, and this is not going up to the stomach, so the stomach bubble has to be different, and this cystic mass has to be separate from the urinary bladder. You can see both the kidneys separately, and they do not show any hydronephrosis. The bladder has not to be very big so as to reach the level of stomach without any hydronephrosis in the kidney. So whatever we are seeing over here is not likely to be urinary bladder. This is the level of herniation. You can see I have tried to mark it with the arrow, and this is the herniation into the thoracic cavity. This is the heart, and this is the colon. You can see there are some hostrations in this, and this is most probably the colon, which is filled with the meconium. and there is some structure, as I just saw. This was the cyst which was troubling us. It is possible that it is the stomach which is there in the abdominal cavity, which is distended, which is which is having traction, and it is disturbed in shape. We do not exactly know, but this appears to be a case of congenital diaphragmatic herniation involving the colon on the left hand side. I hope you like this case. In case you like it, you please subscribe to our channel, share the video among large number of friends so that maximum number of people can be benefited. Thank you very much.